Welcome to A Shot in the Arm podcast. I'm Ben Plumley, and this is a podcast about innovation and equity in global health. Well, it's the end of March, and believe it or not, this is the first episode that we have recorded that's actually dealing with innovation. I wonder why that is. In the course of the next few episodes, we're going to be exploring a major transformation that is happening in the world of healthcare. Whether you're in the global north, the global south, the global east, the global west. And that transformation is artificial intelligence, AI. And our first guest in this set of podcasts to discuss this is an incredible expert based in Israel, but with global reach. His name is Professor Eyal Zimlichman. And he joins us from Israel today. Hey, Eyal, how are you doing?
I'm great. Thank you for having me.
It's a real pleasure. Thank you for joining us. Now, can you explain your title as Chief Transformation Officer, Chief Innovation Officer for the Sheba Medical Center, and also for the ARC? Can you just explain what all that involves?
Sure. So I basically hold a couple of hats. Specifically, when I have to explain about innovation and transformation, I typically look at this as two parts of my life. One of them is the fun part. We all like innovation, right? It's shiny, cool objects. We deal with very nice people, fun people, most of the times. And that's really the fun part of my life. The transformation piece is the painful part of my life. Because to transform, we have to change. And that's very difficult for humans to do, especially in healthcare. Healthcare is a very conservative profession. We learn by imitating others. That's how we've been taught, and that's what we do. And then we have to break that chain and start doing things differently. And that's when it starts being very difficult, to a point it's almost painful. And that's why innovation alone is not enough. Innovation, again, we'll be coming up with the right solutions. We'll talk about AI and what that promises to healthcare. But transformation is really implementing that on a massive scale. And that's what ARC has set out to do. How do we have innovation drive transformation on a global scale? Not just at Sheba Medical Center, where I'm physically based, but around the world. That's our first aim that we set to ourselves when we launched about 6 years ago. And also, once we do that, there's another aim we're looking to bring about, and that is having innovation serve as an economic engine of growth. How do we change the equation from healthcare being a cost, a burden on society in many ways, to healthcare being also an economic engine of growth that drives the economy, that drives welfare, that drives communities?
See, now that's one of the things that is so timely, and I want us to devote a good chunk of time to that, because in every economy around the world, in every society, health viewed as a drain rather than a driver of the economy. Absolutely. But I think the first place to kick off is around the role of clinicians as innovators. And you referred to the shiny objects. And for someone like me who's been in health policy for most of my career, the challenge for innovation and the implementation of innovation has been around, how shall I put it, trying to measure the enthusiasm for a particular innovation, whether it is a new drug or it is a new method of diagnosis. So how do you envisage the clinician as innovator?
Well, we think that's critical. This is the centerpiece for ARC. We see hospitals and other health systems where providers provide healthcare as the center where innovation is required. This is where we need to be active. We need to turn provider organizations, and of course hospitals have huge amount of talent, especially academic institutions, huge amount of talent. We need to turn those into factories of innovation. This is what we've done at Sheba. And some people tell me, well, Israel is different. You guys have it's called Startup Nation. Guys have a different culture. Well, it's not that different than many other countries, but we were able, within a very limited number of years, to drive innovation and commercialization. of many of our solutions 20 times fold. We now are producing 20 companies every year that are leaving Sheba to change healthcare globally. And these solutions are the solutions that will have a huge impact on the next years to come. The reason we're able to do this is through driving innovation that comes from clinicians. Clinicians know the needs the best. They understand the pain points. They are the production floors of healthcare. And when I say clinicians, it's not just doctors. It's nurses, it's allied health professions. We have physiotherapists, we have psychologists, we have social workers. They all come up with a problem. And then through a facilitated process, we come to solutions which we can then scale to products and commercialize as companies. And these companies are the right platform that would move forward across countries, across healthcare systems to really bring this huge impact globally as we see it. So it starts with the clinician, it starts with a pain point, and every clinician has a pain point. We have no shortage of those, unfortunately, right? Not everybody has solutions, but problems, as many as we'd like, right? I mean, there isn't a shortage of that. How do we focus on the right problem? How do we go through a facilitated process to come up with a solution? And how do we scale this up, not just locally, but globally?
So if you look back at the creativity and innovation that's happened through ARC and the Sheba Medical Center, is there any one innovation and then company that you've spun out that really stands out to you and would really give us a flavor of what you're achieving?
Sure. So, I'll go back to probably one of our first ones. It's a company called AI Doc or ADoc. And what they are doing is they have an algorithm to identify life-threatening conditions in CT scans. We basically built this product back then in the emergency department. This was started in 2017. And the idea is that the AI is able to identify life-threatening conditions within basically milliseconds after the scan is done, and then alert the staff or alert the radiologist that there's a life-threatening condition that we need to identify and act upon to save the patient's life. We started with stroke, mostly dealing with hemorrhagic stroke, bleed in the brain, as we know, a very terrible condition. Many people die around the world. We identified through an algorithm the hemorrhage in the brain. We alerted the radiologist, who then took a look at the CT, acknowledged that there is that life-threatening condition, because we need the human at the end of the day to acknowledge. And then the whole cascade starts to intervene and save the patient. We were able to show within a study we did and published last year that this has led to a reduction of 30% in mortality of patients with intracranial hemorrhage. We then looked to see within Sheba what was the impact, and we found that this has brought about saving about 50 lives a year at Sheba. Now, this is the interesting part. This technology is now implemented in 1,500 hospitals around the world. Multiply 50 times 1,500, and you'll get the number of lives that a computer algorithm was able to save. And this is how we are looking at many of our solutions. How do we start with the idea, with the need, with the pain point that we have as clinicians, the problems our patients are facing? How do we find the right solution? Many times AI would come in to help us in that regard, like in this case. And then how do we prove that it works, create the right evidence, and scale this up globally, in this case, 1,500 hospitals in many different countries.
So moving on to the transformation element of implementing that innovation, the first thing that jumps out at me is, cool, blimey, I bet the staff looking after the CT scans and then the clinicians that are interpreting the scans, how do they respond to the algorithm? Is there a welcoming, or is there a repeat of the Luddites in the 18th century who were terrified of the early technological innovations that were happening during the Industrial Revolution?
Right, it's a great question, Ben. It's this is where the transformation kicks in, because the innovation, again, is the fun part. That's the computer algorithm, right? I mean, I could tell you it's not a huge challenge today to develop computer algorithms that would identify a stroke in the brain. The challenge is on implementation. How do we maneuver this through the different challenges that we're facing in large-scale transformation? And one of them, of course, is how is this perceived by us, by the humans? And what we found with this was that the radiologists are not interested in a solution like this to come in as a decision support tool, because between us, of course, and your listeners, that is a threat, right, to doctors, just like it would be to any other profession.
Yeah.
But what we did here was we said, listen, nobody is able to read the scans the minute they come out of the system. There's typically a queue because there's a single radiologist at night. He has a queue, and it might take you an hour, or in a very busy shift, 2 hours just to get to the scan. So we said to the doctors, listen, the AI will only prioritize it for you to read. And the doctor said, we're completely fine with that. We know we cannot read the scan in milliseconds. There's no question about it. And the AI might get it wrong. Worst case scenario, we go through a scan that the AI prioritized and we find nothing. We disagree with the AI, which happens, and we go on to the next scan. But that prioritization, just the prioritization alone, has led to 30% reduction in mortality. And this is where the specific implementation approach, the working this into the workflows, working with the radiologists to see what they would like to have that would help them, and how do we work it into the digital workflows with the other systems that we have in place. This is where, of course, the true value is in turning innovation into a potential for transformation.
See, that I think is a really good example of how AI can absolutely transform both the healthcare provider's experience, but of course also the patient's. I realize as we were talking, Eyal, that myself and many of our listeners and viewers may not actually know how healthcare is provided in Israel. Israel is sort of an interesting country in that it's closely aligned with the United States, but much of its cultural and social and economic institutions are really more European. And so how is healthcare funded and provided in Israel?
So you're right. It is very similar to the European systems that we know. We have basically a single payer where the government everybody has complete health coverage. There's no different levels. It's the same for everyone. And, we pay a certain percentage out of our salaries to cover for those costs. But it doesn't change regardless of what we would consume as healthcare consumers. On the provider side, we can choose 1 out of 4 HMOs, health maintenance organizations. They function in many ways like Kaiser Permanente in the US functions. They provide both the insurance as well as the primary care and some of the secondary and tertiary. And then we have hospitals like Sheba. Some of them are government owned and some of them are owned by the HMOs. And you could go to basically any hospital. So the bottom line is, it's 100% coverage. It's a very high level of coverage for all of the level of population. And what drives a lot of the value is the competition between the HMOs. Because unlike, for example, the UK, where you have the NHS services, or like Canada, whereas there's a specific provider, there are 4 here. And the competition between them to draw the people to sign up with them, that competition drives the value. And that competition drives a lot of for example, the digital transformation that happens. Israel was one of the first countries in the world in healthcare to go completely digital. 100% of coverage with electronic records, patient portals, sharing data between all providers. When a patient comes into Sheba Medical Center, I have full access to his data from every other provider in the country. So there's a lot of advantages to doing that. Of course, I could talk a lot more about healthcare in Israel, but I'll keep it at that for now.
Well, thank you. And that was very interesting because I think it gives a glimpse into the various ways innovation can support a centralized national health service, or indeed health management organization based approach, and the various iterations of those, versions of those, play out in different parts of the world. So that was really helpful. Turning more broadly to AI, what's your sense of where this is leading? What innovations are you really excited about coming down the pike?
Well, it's obviously that's the biggest buzzword today, not just in healthcare, but across the world, in every domain. And I think it's justified. We've seen AI mostly what we call the predictive analytic tools that have been around, like ADOC I just described, that started in 2017. We've been using AI at Sheba in the past almost 10 years on many, many different aspects. Of course, we'll see much more of that happening. The machine learning, the deep learning, neural networks. That's going to continue, and that's going to intensify because we're getting more and more access to data, which of course is critical to build these kind of solutions. We're going to base our decisions, like in the ADOC example. We need AI to help us make better decisions as clinicians, but also as healthcare managers. How do we improve our decision making as managers, as managing financial systems? Hospitals are very complicated systems to manage. We need as much help as we can. AI will help us with that. What we're seeing coming right now over the last 2 years is the generative AI solutions. And they, of course, are a perfect match for healthcare because the generative AI is about language. Right? We call them large language modules. And healthcare is about language. Healthcare is not so much numbers. We're not a financial, we're not fintech. We're not dealing with forecasting the weather. We are all about language. We're about the interactions between providers and patients. And that is, of course, all about language. We write free text in our systems. There's quite a lot of that going on, as we all know. Large language modules and Gen AI are specifically positioned to completely transform healthcare in many, many levels. And it starts with what we're already starting to see. We have now AI basically listening to the conversations we're having with patients and summarizing that into the electronic record. We have conversational AI speaking with patients already. We're going to see much more of that happen. That is going to improve accessibility to healthcare in a fashion that we've not seen before. Healthcare access will become something that is no longer only reserved to people that are in the city centers, but to everybody. You're going to have a question to your doctor, middle of the night, there's a number you can call, you'll have a conversation with an AI that will provide you an answer. So
this I think is really a very positive vision of the future because it enhances the patient's experience of healthcare, the consumer, if you like. And I love the way that you described that it doesn't replace, but you can envisage a AI helping the dialogue at the right of the start of a patient visit, whether it's in person at a spoke clinic or, as you said, on the end of a telephone or through chat, but getting through, COVID questions, for example. Have you got a cough? Have you had a temperature? Have you been around someone who has had COVID? And so that sort of, rather than replacing the experience of interaction with the healthcare provider, what it does is help speed that access up. I love that.
Yes, and we're going to see what's going to be extremely interesting over the next decade is we're going to see the health professions change because of this new player. AI and specifically Gen AI with the capabilities around language and reasoning and empathy. We know that there's numerous clinical studies that have shown that that conversational AI carries empathy. Sometimes that is seen by patients as even greater than what humans are providing. And so that's going to start shifting what doctors are, what nurses are, what do we leave behind? What do we move forward with? What new capabilities will doctors of the future need? So the whole new player coming in with the AI is like introducing a new health profession. Once we had the nurse practitioners, they started taking away some of the things from doctors and some of the things from traditional nursing, the registered nurses. And so the new profession has shoved both other professions into new limits. And this is the introduction of AI into this world with the impact that we're going to see on all health professions.
I love that you raised the nurse practitioner example. It's something I've been heavily involved in throughout my career, an innovation that frankly emerged in some of the donor-funded programs in Africa, particularly. And this idea of where you had very few doctors, you could empower nurses and engage them to provide a level of diagnosis and engagement that perhaps the physicians couldn't. And of course, you see that innovation now playing out in countries like the US, the UK, and Switzerland. And what's your sense of how AI could support them?
Well, I'll give you another example. It's another one of our inventions. Now it's a company called ASAP. And basically the idea is that we use AI, an ultrasound probe, $150 on almost any shop on Amazon, and your smartphone to do currently a full cardiac echocardiography, an ultrasound of the heart using AI and very simple tools. Once you capture 4 images of the heart, again, directed by the AI how to capture, you have to place the probe in the right angle, but then the AI proves that. Once those 4 images are uploaded to the cloud, out comes a full report, just like it was written by a cardiologist. Now, we give this to the hands of nurses, for example, and you enhance their diagnostic power many, many times fold. Imagine that nurse with this kind of capability in a low-income country, now able to do a diagnosis of heart problems, now able to do diagnosis of deep vein thrombosis, able to do diagnosis of abdominal aortic aneurysm, which we need to be able to screen for, or for plaques in the carotid. These kind of tools will really democratize very sophisticated diagnostic tests that now cost a lot and require a lot of competency to manage, to a point where a nurse would be able to deliver all of those diagnostic tests anywhere on the planet.
Yeah, absolutely. I think that, again, is a very positive vision of how AI can help us. We spoke at the start of the role of hospitals, sort of tertiary care. And I think a model that has emerged in many countries of the world is sort of the hub and spoke, with the tertiary care centers, the advanced hospitals, I guess, like Sheba, being the hub, but connected to a wide range of community-based, rural-based, urban center-based spoke clinics, as it were. And I wonder how you feel that the hospitals, the investment in the tertiary care can help expand access to care rather than, the risk, which is, of course, to centralize things.
Yeah, it's a question that goes back to the even bigger issue of the roles of hospitals in the future. And as we look at the future of health, would hospitals stay the center of the universe, right? And if you ask the traditional hospitalist, and of course they would say yes. If you're a hospital administrator, you want your business to stay alive, obviously, and hospitals need to remain the center of the universe, where we treat the most difficult patients, but also where we educate the next generation and where we conduct research. That's been the traditional role. We think that hospital role would diminish actually in the future, because technology would allow us to extend the operations beyond the geographical part of the hospital. Geography will play no issue anymore. We call it health without an address, where you're treated, for example, by Sheba, regardless of where you are. You could be on vacation and see a specialist. You could be anywhere in the world. And this is where technology specifically will allow us to bypass the needs to come physically to the tertiary center. A hub and spoke is all about geography, if we think about it. Central versus periphery. But that will not be the case. Virtual will be the case. And in virtual, there is no advantage to the hub versus the spoke. So that democratization of healthcare around the world will help us to provide access where geography, again, will play no factor.
Well, there's an education for me, born out of the British healthcare system, tertiary, secondary, primary care. I love the idea of that being completely eradicated. And it gets me to a thought that I've had, and I'd love to test it out with you. We're in a moment in time where the funding of particularly developing country donor-assisted healthcare systems is under huge strain. And it's a moment of shock, but it's also a moment of opportunity. I just have this sense that countries like Botswana, Kenya, South Africa, Nigeria have the opportunity essentially to leapfrog countries in the West, like the UK, that has a very, let's be honest, 1940s healthcare system, using the models that you have spoken about. Does that resonate with you? What are the challenges that they might have in embracing that?
Well, completely. We talk a lot about low income versus high income. The high income countries are far from figuring this out. And because we do so much work around the world in many of these leading countries, we see the problems. And I call this, healthcare is in a crisis, is an existential threat. And in these developed countries, we're in a threat where the next generation will actually receive care that is diminished than the care we are receiving today. It's a frightening thought that we might be at the pinnacle of healthcare. This might be the peak, and it goes downhill from now on. Developing countries that need to build their healthcare system need to take that into account. Last thing you want to do is to build those healthcare systems that will run us against the wall, just like many others. And so you're absolutely right. Once you build a system, there are ways to build a system in a much more, effective and efficient way than the current systems in the high-income countries are built, where we're very highly dependent on digital health. AI solutions are very cheap, if you think about it. Implementing algorithms is not very expensive. Saving 30% of human lives by introducing an algorithm into the emergency department costs a fraction of buying a new CT or MRI scan. And so this is where we need to invest our technology. So if we build the systems in some of the countries you've mentioned on the premise of current existing systems, and we say, listen, you guys need to buy an MRI machine, you guys need to buy a surgical robot, that will not work. The money's not there, and the outcomes will not be better as we look in the future. And it won't be sustainable in the long run. If we build a system in a way that where we rely on digital transformation, where we rely on digital tools, where we rely on solutions like I've mentioned, doing a full body ultrasound scan at the cost of an equipment that costs $150, this is where these countries need to leapfrog. And this is where the transformation that is also coming out of ARC, some of the things that we're trying to push forward in the world, will be transformational for those countries, not less than maybe even more for countries that have much more funding to spend on this.
That is really exciting. One of the other things that you've spoken about, and I'd love you to sort of expand on that, is the idea of hospitals, healthcare, as drivers of economic growth, rather than as the sponge that soaks it up and which gives such palpitations to government treasuries. Can you explain a little bit of your thinking on that?
Sure. So, it has two sides to it. One is, how do we drive down costs? Again, hospitals are extremely inefficient. We run shops that, in any other industry, governments would replace us, replace management, start from scratch. We're very, very inefficient. We're not efficient in using our own workforce. We have huge workforce problems, and so on and so on. So one thing is, how do we become much more efficient? And this is a big part of where innovation needs to come in and help us. And again, there's a lot of examples on how to drive efficiency and becoming much more cost sustainable. That's number one. But more interesting, again, goes back to what we started with, And this is innovation as hospitals as factories for innovation and commercialization. And to give you a couple of examples from Sheba Medical Center, we were able, in a matter of 5 years since we officially launched ARC, to create more than 112 startup companies with a total valuation of $5.8 billion US dollars, and have created 3,500 jobs that are not nurses and are not doctors. These are business people, these are engineers, computer folks. This is not something that a typical hospital can produce. And we call this an economic engine of growth, not because of the check that it might bring back to the hospital, which is nice always to have, but because of the impact on society. The 5.8 billion goes back towards taxes. Those taxes are then reinvested in education, welfare, and so on. This is paying back to society. Those 3,500 jobs that were created, again, go back to society. So this is where hospitals have a role, not just to treat patients, which of course we all acknowledge, but also to be a major part of society to drive economic growth for our populations. And this is what we were able to accomplish. And this is what we're taking now to the world with the different ARC sites that are now being built around the world in many of the major cities, in many of the different countries.
I've had a relationship over the years with the Infectious Disease Institute at Makerere University in Kampala, Uganda. And it initially started off as an investment from the chief executive of Pfizer at the time, but its aim was to be a center of excellence in research and training for infectious disease experts, particularly dealing with HIV. But I really see the potential, again, going back to these countries that are able to leapfrog the healthcare provision model of, let's say, the second half of the 20th century to get into this model of innovation and generate income in their countries, in their regions, rather than, soaking it up. I think that is such a good way of thinking about it. Now, in talking about artificial intelligence, while it's clear that both of us are very enthusiastic about its potential, it wouldn't be fair if we didn't look at the dark mirror, the sort of dark AI side of things. What are your concerns? How do we ring fence and protect AI going forward? What are the things that could either be used for nefarious purposes or which could make healthcare less appealing for folks to use?
Well, of course, it's a critical issue. The whole governance of AI, we at Sheba and ARC have been leading that as well with many of the fences we've been putting in place to guardrail against potential problems. And problems could be anywhere from just being inaccurate, and every diagnostic device can be inaccurate. When you do an MRI, the cost of a lot of money, you still can make an error when you read that MRI. AI is not very different. It can make a mistake, and that's why it's up to us doctors to really use this as a decision support, not replacing the doctors. That's number one guardrail. But that goes all the way to what we call now with Gen AI hallucinations, which we need to be very much aware of. And there's a lot going on in the world right now to prevent that from happening. And I think we're going to see in the next couple of years the new models, which would be much more safer, to see much less of those hallucinations happening. It's one thing when you see an hallucination when you're trying to write a report for school, but it's a very different thing when that hallucination is treating a patient, right? And this is exactly where we need to be very, very, very careful to make sure that this is not happening. And when we talk about large populations, the whole issue of validation to specific populations is critical. One AI algorithm that works on one population will not automatically work on a different population. We need to make those adjustments. We need to be very much aware that this is required. But if we are aware, and there are mechanisms in place to make sure that we validate and adjust to different populations, then again, this would make it a much safer use. We're working now very closely with Mayo Clinic and some other partners to build a shared data platform to allow us to do exactly that. And this is across countries. We have on the founding members, Brazil, US, Canada, and Israel. And we've now added many countries in Asia and other parts of the world into this new data platform that allows us to validate AI algorithms in different populations and adjust for different societies, different genomics, and so on, which we know exist around the world. So yes, being aware of these risks, being able to mitigate, have the right guardrails, and having the right methodologies in place to really build this into our systems is critical.
That's very helpful. And I see that we're coming up to the end of our time, but is there anything we've missed? Again, any of your enthusiasm? Ben, we didn't cover this and we really should have done.
I think, where I'm very, very passionate about is what I call the culture of entrepreneurism, and where entrepreneurship needs to play a role in healthcare. We need to move away from being this conservative, watch and learn sector that we've been for the past hundreds of years. We need to break that. And I firmly believe that changing the culture of organizations to a culture of entrepreneurship and innovation is the right approach. Changing from doctors that are very hesitant to change to doctors that are looking for the opportunity to change, to improve all the time. I myself am a physician. My passion for many years was quality and patient safety. I thought that it's not okay that we're hurting patients in hospitals where they're coming to get treatment. And I grew from there into innovation because innovation needs to play a central role in improving the way we care for patients, in preventing harm and becoming much more effective and efficient. So it's that journey that healthcare needs to take over the next decade if we're going to see huge change and improvement that we've not been able to see over the last couple of decades.
Yeah, absolutely. It resonates with me because it echoes, I think, what happened with the HIV movement from the late 80s onwards. This sense that the trajectory of empirical medical science had basically sorted everything out and it was just plain sailing from there on. No, we hit some really significant roadblocks and it required innovation. And I think a lot of what you said would resonate with a good number of infectious disease doctors that I work with. Yeah, absolutely. Well, Eyal, thank you so much for a absolutely fascinating conversation. You really are on the cutting edge, and I wondered if perhaps we might call on you again in the future and let us know if there are innovations, things that are coming forward that you think it would be interesting for us to know and to showcase. It's been absolutely terrific. Thank you.
Thank you, Ben. It's been a pleasure on my side as well, and I look forward to being again in the future in your podcast. Thank you.
Super. Well, that's it for this episode. Thank you to Eyal Zimlichman, who was just an incredible guest. Really fascinating insights for me. Lots to reflect on, I think. Thanks also to Erica Spera, our director and producer from NewsDoc Media. Thanks also to Waisha Raphael, our production coordinator from Josie Joburg in South Africa. And finally, a big thanks to you. You can find us wherever you download your podcasts, and a shout out again to our YouTube channel, where you can see Eyal and I in beautiful Technicolor chatting away. Well, with that, have a great week and a safe week, everyone.